Well, so first of all, let's talk about the formation of the kidney stones. How the kidney stones are actually formed. The very beginning, the very first thing, formation. First, you guys must know that we have two kidneys in our body, and those two kidneys are having some kind of tubes known as ureter, and these tubes are actually moving towards the urinary bladder, and then at the end we have urethra, from where the urine is actually discharged. So first of all, let me tell you how the urine is formed. Well, the blood is actually filtered inside the kidney, and when we just take this one kidney and we zoom it, so we'll get this kind of structure. So inside which we will observe such kind of circular shapes, and inside there will be such kind of tubes being seen. The tubes are known as nephron. Now this nephron, and there are several nephrons, and these nephrons are actually the functional units. Okay, so this is actually the functional unit, nephron. Now what it does is simple. The blood will come through this particular tube, and then it will be filtered, and at the end urine will be formed, and that urine which is formed will be directed through this ureter and will come here in the bladder and will be stored for a while, and at the end of the day it will be moved out. Okay, so this is how urine is actually produced or formed or synthesized. You can use any word here, by. So I'm trying to use the word that is actually easy for you guys to make you guys understand about a particular point. So well, now what happens here, by first of all, let me tell a little bit more about the nephron. In this nephron, what's happening? It is actually filtering the blood. Okay, and from that blood, it is just producing the urine. Then, and then that urine is then forwarded towards the ureter and urinary bladder and then moved out. And in the meanwhile, in this filtration, it is actually managing or regulating our body fluid and electrolyte. So you can say, in short, it is maintaining the electrolyte balance in the body. So what happens when sometimes the balance actually fluctuate or it moves so high? So then what happens? The higher concentration is actually filtered from this particular portion of the nephron known as glomerulus. So when it is moving through these tubes, somewhere in the tubes, it may stick. After it sticks, so it then starts accumulating more those particular electrolytes, especially if we talk about the oxalate. Okay, because it is the most common cause, the most common stuff responsible to cause kidney stones. So what happens in the beginning? It is actually only a dot hereby, and very small stone is there. So with the passage of time, when there is excess of this oxalate in the body, so that will come and will start accumulating here, accumulating. This accumulation will lead towards the formation of a stone, and this stone can and may become larger. So when it is in the smaller shape, it may pass easily from the blood, from your body, and via urine, with the urine. Okay, so when it is becoming larger, so then it is very difficult to move the blood, move that particular stone via urine. So it cannot be passed in the urine easily. Then we go for certain medication therapy and some other therapies. Okay, well, so what is happening here? We're talking about the formation. So when the electrolyte balance is actually changed, so this electrolyte will start accumulating hereby. The more it accumulates, the more the shape of the stone is actually changed. Means it is becoming harder and stronger. So remember, this stone can be formed in the nephron, and then as it is formed, it can move further, and stones can be formed here also in this particular region of the kidney, and it can be if that kidney stones move, actually they can also block this ureter.